Thank you for inviting me to launch the Australian Institute of Health and Welfare's report, Australia's Welfare 2021. This is the 15th report since the Institute began its series back in 1993, and each report has helped create a comprehensive picture of our welfare system. As a government, it's essential our social security system is targeted to those who need it most, and your reports continue to be an important resource to ensure that we can do that. This year's report will be especially important to understand the impacts of the coronavirus pandemic on Australian families and give us the tools to develop solutions. It shows that compared with many other countries around the world, the impacts of the virus in Australia have been more constrained. But there is no doubt that the pandemic has been incredibly tough for those Australians it has directly affected. That's why the government has stood side by side with Australians throughout the pandemic and will continue to ensure Australians have a safety net to get through the lockdowns, whether that be the COVID-19 disaster payment, pandemic leave payment, or the social security system. Throughout the height of the pandemic, we provided $32 billion in emergency support payments, and on top of that, we have delivered the largest increase to unemployment benefits since 1986. It was heartening to see the economy bouncing back with the total number of employed people returning to pre-pandemic levels in May 2021. Unfortunately, the current lockdowns are again taking their toll, but as our vaccination rates across the country continue to rise, I'm confident our economy will rebound quickly. On top of financial support, we also need to have services in place to protect and promote the wellbeing and health of Australians. Sadly, we know that lockdowns can increase the likeliness of domestic violence, which is why the government provided $130 million to the states and territories at the beginning of the pandemic to ensure that frontline services could continue to support women and children experiencing violence. In the budget, we made a record $1.1 billion investment in women's safety, which is a down payment as we transition to the next national plan to end violence against women and their children. Your report also details the impacts lockdowns can have on mental health, and we're committed to ensuring Australians have the confidence to reach out when they need help. That's why in the 21-22 financial year, we've provided a record $6.5 billion for mental health and suicide prevention. The Morrison government will continue to support Australians through the pandemic, making sure that our policies and programs target those most in need of support and that our welfare system remains strong and sustainable into the future. To do this, we need the evidence on which we can base our decisions. Thank you again to your team at the Australian Institute of Health and Welfare for your contribution to this evidence base. The Institute's insights continue to be an important resource for policy development and program delivery, especially the current report, which will help map our road out of COVID. Thank you.